another wonderful episode here, just podiatry. We have a young patient who has presented to our office today with not one, but two ingrown toenails. Extremely painful, indeed. So our goal today is to eradicate pain as well as infection. In respect to the left great toe, the patient has notified us that it's been draining. Am I correct? Draining, a little bit of pus, and
Yes.
this has been going on now for how long?
For 3 years. Down the ingrown nails.
Right. So this is a chronic problem. We're going to eventually, focus our efforts on performing the permanent procedure. But today we're going to eradicate the problem. A lot of people ask me, but Dr. Wagner, why don't you use the phenol? Why don't you just do the permanent? In the presence of infection, it's a contraindication to do that procedure. Very important. I'll say that again. In the presence of infection, it's a contraindication to do the permanent procedure. Let's go. Patient's doing great. You okay there?
Yeah.
Okay, remember there's a difference between pressure and pain, okay? All the way to the back there. No tourniquet. This is big. This is big. Look at the size of this. Show everyone here. What's interesting is it is almost the size of the nail. Interesting. This is absolutely ginormous. So that's one. Yeehaw. We'll just double check here. Nice and clean. Everything looks great. Super. So let's just leave that there. Let's go to the other side. Here we go. How you doing, patient?
A little bit.
Okay. We're almost done here. Almost done, okay? Excellent. Last part here. Here we go. Another big one. Okay, we're all done. This is just a little bit of connective tissue there. Skin, connective tissue. We're all done. Okay. And everything's nice and clean here. Okay. And then I did tell the patient that I was going to trim one nail with blood flying all over the place. Okay. We'll do the same to this side. aggressive snap back here, right? Got really, look at, you see, all the way in. So it doesn't happen there. Same thing here. Sorry guys, but I don't want. And then the little spicule here. We're all set. Okay, we're all done. A lot of cream. Antibiotic cream. Or Coban. That's one. And we're all done. Double whammy. You did great.
Thank you.
The one on the right was really, really big. Goliath. Mammoth. Let's show the patient.
She's it'll be on way under.
Yeah.
So,
You know, some of these, I've noticed throughout the years that the ingrown toenails that come in, like yourself, where it doesn't really, you know, it hurts, but it's been there for years. And chronic. 3 years versus the patients that come in with like a really infected, like, you know, like the pyogenic granulomas are, you know, hanging on top of the nail plate. I've noticed that that this clinical presentation, the nail plate itself, the ingrown, is larger than the, you know, the other type of clinical presentation, where it's all just draining and there's cellulitis and everything else, pyogenic granuloma, pus, the whole works. The nail itself, the ingrown nail, is smaller.
yeah.
As always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. I want to take this opportunity to thank the patient
Thank you.
for allowing us to educate the world using this platform. Have a wonderful week, everyone. Thank you.